Hello chiropractors, slayers of subluxation, unleashers of the imprisoned impulse. I'm Dr. Anthony Pellegrino from ChiroEdge, and welcome to the Chiropractic Research Breakdown, where each week we break down the most relevant chiropractic science philosophy to empower you with the ammo and certainty necessary to change your community from the inside out. We're going to be short and sweet with stuff today. We're going to be talking family care, we're going to be talking concussion. We've hit these topics up a lot in the past. This is what researchers like to speak, so we're going to talk about it again. What I did want to talk to you guys about as well is one thing that we've been doing with whether you are subscribed to the ChiroEdge service, which takes these articles that we talk about every week and breaks them down into patient-specific newsletters and social media posts. We've been hitting it up in a third way recently in our practice, which is that we've been taking these articles and basically transforming them into patient education videos and been using them on Facebook, Instagram, etc. And been running ads in specific ways that has really done really great in allowing us to it's been really great in allowing us to really become the authority in our community, as well as to really be able to generate new leads and new patients in the office. It's been working really well. Now, I have a strategy that I've been doing that really helps 10x the usage of our videos, and if you're using video ad or just making videos for your office at all, I highly recommend you following this, just because it's something really simple that you can do to not only to drive new leads to your practice or new patients to your practice, but also just improve your SEO really easily with almost no additional work from you. So what I did for you guys was I put together a nice little guide. It's going to be hosted up, depending on when you're listening to this later today. Put together a nice little guide you can find at chiroedgemedia.com/10x. And it's a guide to be able to 10x the impact of any video that you make for your practice, put on Facebook, and how to be able to use tools to automate distributing that through multiple channels, including embedding on your website, how to really maximize the impact of every video that you guys make. Again, that's chiroedgemedia.com/10x. And I look forward to delivering you guys some value with that. So go check that out. This is a totally free report. I just want to give you guys as much value as possible, so there's no ask. There's no anything on that. I'm not going to try to upsell you anything. I just simply want to give you a report because it's been working really well for us, and I want to see more people under chiropractic care. All right, so with that, let's jump right into it. All right, I'm excited to take a look at this article with you today from the Journal of Pediatric, Maternal, and Family Health from Dr. Pam Stone-McCoy and Dr. Shannon O'Brien, and it's called Health Outcomes of Pediatric Patients Undergoing Chiropractic Care Since Birth, a retrospective analysis. So this is a retrospective study, which basically means that rather than saying, hey, we're going to be collecting this data to publish in the future, they collected data and then afterwards said that we are going to go publish what we had in the past. So an example would be, let's say, a prospective study would be doing like a double-blind randomized control trial. You have to go through like ethical boards and different stuff like that, and there's also state law surrounding, especially I just know for New Jersey is that you couldn't collect money from a prospective analysis from anybody. Typically, somebody who participated in like a drug trial or something like that, they actually get paid for participating. So in a practice setting, where you actually are, collecting dollars and afterwards saying, hey, let's see, what we found. Retrospective is really great. A good example of something that you could do is, let's say, you use like a QVAS for pain scales. You can go and say, hey, everybody over the last 6 months who came into my office, this has been the percentage change with QVAS we've had in the 3 months under care. That would be something you could do for retrospective. But with this, what they're just looking at is simply just wellness care. And they go through a really good definition in the introduction of wellness care, complementary alternative medicine, chiropractic care and wellness, and something like that. And something that I just want to bring attention to is because I believe, and I hope you believe as well, is that the words that we use are important. In podcasts in the past, you've heard me rant about saying subluxation and not joint dysfunction, and saying adjustment and not manipulation, because I believe that words are important. And the same way as Some people say we shouldn't use the word subluxation because it means something different to the medical community, and that's fine. And they actually go through and look at the definition of wellness. And even wellness as a whole in the allopathic medical community is used different than chiropractic, which is more of a salutogenic model, right? So if you were to look at an allopathic model, which is just simply based on treating disease, and the absence of disease is health, which is allopathy, when they term wellness, when they define wellness, they're talking all about early detection of diseases through diagnostic testing. Now, I believe, and I hope that you do too, is that early detection is not prevention, and I think early detection is really great for drug companies because the earlier we detect it, the more we can sell drugs and surgery. Whereas in a chiropractic model, a salutogenic model, where it's not necessarily treating the disease, but rather creating the environment in which health is achieved, because with health, less symptoms can be present, creating an environment in which symptoms don't arise because we're creating health. She says that the purpose of wellness care is to optimize the levels of function and provide a process of achieving the best possible function and health. So when you look at this, right, when we use just the word wellness, we talk about we're a wellness office and we're a wellness center. For a lot of people, what wellness means is taking a preventative thyroid medication. I mean, that's the truth. It's what they're told that they should do, taking preventative Tylenol. It's like, that's insane. When we use we need to be very, very, very purposeful in how we define and what words we use. And if we choose to use wellness, be very clear on that, right? Many times, even with that, we talk about wellness care, wellness, and maintenance, and sometimes we use those words interchangeably, but the thing is are they actually different? Because maintenance, for somebody, might say, well, what do I have to do to just make sure I prevent issues from happening in the future? Whereas wellness is saying, what do I have to do to make sure that I'm living life optimally? In the intro, they talk about how a survey of health promotion activities associated with maintenance care for chiropractors found that 90% of the 658 chiropractors surveyed agreed that the purpose of maintenance care was to optimize health. 88% agreed it was used to prevent conditions from developing. 86% agreed it was palliative care. 95% agreed it was used to minimize recurrence or exacerbations. So, I mean, that's basically what wellness is, but look at how the more people agree, even in chiropractic, that it's about prevention and not necessarily about creating optimal health. All right. So this study was the doctors used the doctors published a study, distributed a health questionnaire to 5 different families, and basically asked parents to rate the health of their children, because one from each family was under chiropractic care. Now, all of the mothers were under chiropractic care from pregnancy. Most of them, 80% of them, were under chiropractic care before pregnancy. They saw a decrease in symptoms such as low back pain, extremity numbness, and generalized soreness. 4 of the 5 children were born vaginally with no complications, and child 2, who was born vaginally, had presented with a transverse fetal position during the 3rd trimester. His mother was adjusted during labor, and child number 2 turned before the mother needed to deliver. There was one child who was born via C-section due to unexpected or a larger than expected baby with no further complications. So that's 80 or 20% C-section rate, which is better than the average. And it's only for 5 people, so it's a really small sample size, but just doing some math. Anyway, all the parents from the study noted that their children ate a well-balanced diet. Every child was extremely active and physically healthy, got plenty of exercise. They participated in track and field, martial arts, swimming, and baseball. Each child also has a consistent bedtime, most of them falling asleep quickly. One of the children had night terrors 2 to 3 times a week when he was younger, which resolved. When the parents were asked to rate the health of their children, majority of the parents felt as though their children were healthier, having been under chiropractic care, and all the parents felt as though their children were healthier than their friends and other children of their age. So that's it. 5 families, chiropractic care, children are just healthier. Parents think the children are healthier. And that's awesome. I mean, that's what it's about. It's not something that I would go and distribute as proof to the hospital near me and say, let's include chiropractic and in the care of every child born. It's not that level, but it's just compelling case series. Just something good to start your day. I hope it did. Alright, this study that I am excited to go over with you guys is called Changes in Measures of Cervical Spine, Vestibulo-Ocular Reflex, Dynamic Balance, and Divided Attention Following Sport-Related Concussion in Elite Youth Ice Hockey Players. Now, as you can imagine, this article is out of Canada because we're talking about hockey. So they were looking at what changes happen in all these elite top 20% hockey players. And what's really interesting is that they just basically did preseason testing. They looked at a bunch of preseason things. They looked at, where's my list here? Symptomatic change, cervical spine function, vestibulo-ocular function, dynamic balance, and divided attention. And then they did it all preseason. Anybody who had a concussion, then they did it afterwards. So they were able to get all these data points. They said that concussion is the most commonly occurring injury in youth sport and recreation. It's defined as a traumatic brain injury induced by biomechanical forces. Most commonly, the symptoms reported afterwards is headaches. From there, there's also dizziness, nausea, and neck pain. The cervical spine may be a source of ongoing neck pain and headaches. It has also been reported that the vestibular system and or the cervical spine may be injured at the time of concussion. So because of this, rehabilitation with techniques should be aimed at targeting the cervical spine and vestibular balance systems, and because it's demonstrated positive effects with individuals with ongoing symptoms. So in adults, and one thing we've mentioned before, concussion symptoms should not really ever last more than 1 to 2 weeks. From there should be full recovery. And in children, this is often, it just takes longer for them to recover, up to 4 weeks for full recovery on average, which is something that is definitely important to know. So they looked at all these kids, and what they found was that the most common change was that of the cervical spine. Now, something interesting is that a total of 559 athletes were surveyed, and of those, 97 sustained a concussion during the regular season of play. So we're eligible to participate. That's 17% of the kids in this league got a concussion. 20%. They go hard in Canada. 71% of the people with concussion were able to complete measures of cervical function, the vestibulo-ocular function, the dynamic balance. They looked at all those. Following concussion, symptom complaints reported to increase for neck pain in 42%. 58% of people had headaches. 40% of people got dizzy. The new neck pain was occurred in 32% of people because a lot of them had it beforehand. So following concussion, 20% of the individuals surveyed had less than full range of motion in one direction. And this is remembering kids 13 to 17 years old. The cervical flexion rotation test prior to injury was present in 2% of individuals, and that jumped to 20% following concussion. So you just kind of see the amount of change that happens in the cervical spine. They believe that change in control of head and neck motion may occur secondary to altered processing of sensory input. Some interesting things they found is they did things like divided attention tests, as well as balance and gait, and they found that in individuals they actually saw an improvement in those things throughout the course of the season, even after concussion. So the amazing thing here is that these brains of these young athletes are soaking up and learning new motor patterns so quickly that even after concussion, many of these things that they looked at had actually improved. So when we look at that, there's two ways of looking at it. We can say, okay, well, concussion probably doesn't affect balance, which we know is not true. But the tests that they were using, the kids were able to learn how to do it so much better that even after concussion, they still better before preseason. So that just kind of brings up even more the fact that because we know of the input that's happening, that because of the changes in the cervical spine that's happening following concussion, where we jump from 2% to 20% having a positive rotation test, cervical extension rotation test. It's just crazy to think of the altered input that's going up to the brain, and that how much that's can sit there, how much the influence of the cervical spine, even more so than the other tests that's simply just brain tests, right? How much the cervical spine is being influenced. Now, to kind of repeat it over and over and over and over and over again, what we know is that whenever there is a change in a range of motion, whenever there is a change in the alignment, in the structure of the cervical spine, and it's going to continue to bombard the brain with information, afferent signals, going up to the brain, going up to the frontal cortex, which can have it can have via the hypothalamic pituitary adrenal axis, it can have an emotional response. It overall just changes that child's perspective of the universe, or of the world, right? Because they aren't receiving proper input from the brain. So in these kids, 20% of the kids assessed had changes in, had a concussion throughout the season. It just really brings up the fact that we really need to see any athlete to put their body in the best place to be able to recover, because it's not even like an if question, if we get a concussion. It's almost like a when, right? Because 20% of kids in one season are going to get that, are going to be concussed, and it's like they're not only going to play one season, they're going to play for the rest of their lives, at least in elite hockey. Anyway, really simple for you guys today. That's just something to keep in mind whenever you talk to athletes this week, when we talk to parents of athletes this week, that the rate of these traumatic injuries is so high, and what's being affected even more so than the brain, even more so than reflexes, is going to be the cervical spine. So we need to make sure that that's in the proper position and it's going to function properly in order for an optimal recovery. All right, you've listened to another episode of the Chiropractic Research Breakdown. As always, I am your host, Dr. Anthony Pellegrino from ChiroEdge. As a reminder, we want to be able to deliver you guys some value this week, some additional value, and you can claim your free report on how to 10x the impact of any video you put on your Facebook at chiroedgemedia.com/10x. Thank you guys so much, and I look forward to seeing you guys next week.